Hello viewers, welcome to my channel Human Diseases and Genes. In this video, I will discuss about Hunter syndrome. Hunter syndrome was first described by Dr. Charles A. Hunter, a Canadian physician, in 1917. Dr. Hunter reported the condition after observing two brothers with similar symptoms, including distinctive facial features, joint stiffness, and developmental delays. He noted the family occurrence and recognized the syndrome as distinct from other conditions, which laid the foundation for understanding Hunter syndrome as a specific, separate genetic disorder. And this is why the condition is named after him. Hunter syndrome, also known as Mucopolysaccharidosis type 2, that is MPS II, is a rare genetic disorder that primarily affects males. It is caused by a deficiency of the enzyme iduronate 2 sulfatase, that is IDS, which is essential for breaking down certain complex molecules known as glycose aminoglycans, that is GAG. Without sufficient level of this enzyme, GAG accumulate in the body, leading to a range of death. Hunter syndrome is a rare genetic disorder. Its prevalence is estimated to be between 1 in 1 lakh to 1 in 1 lakh 70,000 live births. Symptoms of Hunter syndrome can vary widely in severity and may include developmental delays, broad nose, thick lips, prominent forehead, enlarged tongue, short stature, joint stiffness, hepatosplenomegaly, breathing difficulties due to the accumulation of gas, frequent respiratory infections, cardiovascular problems, hearing loss, thickened skin, especially over the shoulders and upper back. Those with a severe form of the disorder may have significant cognitive and physical impairment and a reduced life expectancy, often due to respiratory and cardiac complications. Milder forms of the disease may allow for a longer lifespan with more manageable symptoms. Hunter syndrome is caused by mutation in the IDS gene. The IDS gene is located on the X chromosome at position Q28, consists 9 exons and spans approximately 24 kbdn. It provides instruction for making the enzyme iduronate 2 sulfatase, which is essential for the breakdown of complex sugars called glycose aminoglycans, specifically dermatan sulfate and heparin sulfate. It is inherited in an X-linked recessive pattern. Because Hunter syndrome is an X-linked recessive disorder, it primarily affects males. It is typically diagnosed based on clinical symptoms, family history, and confirmed through genetic testing or enzyme assay tests to measure the activity of iduronate 2 sulfatase enzyme. Treatment options for Hunter syndrome focus on managing symptoms and improving quality of life. Enzyme replacement therapy, that is ERT, with a synthetic version of the deficient enzyme called idursulfase and clapprase can help to reduce some symptoms but does not cure the disease. Other treatments are supportive and may include physical therapy, surgeries to address specific complications, and medications to manage symptoms. This is all about Hunter syndrome. Thanks for watching. If you found this video helpful and learned something new, please like this video and don't forget to subscribe for more health insights. Share this video with friends or families to spread awareness. If you have any queries, drop a comment. I would like to hear from you. Don't miss my next video. Until then, stay informed and take care of your health. Thank you very much.